Candy and I, we're both dental hygienists by trade. And we developed this course actually for dental professionals a few months ago. And then she was like, dental professionals, they need this obviously, but like we also feel like maybe there's some parents out there who might also appreciate this information and also our other medical healthcare providers. And so we're so grateful that you're here tonight. You can learn a little bit more about dentistry. Candy was actually one of my students in dental hygiene school, and she was such an excellent student. And we started a business together, a little YouTube channel. That is how we know each other. But this evening, what we're going to talk about is our special needs oral health. And Candy's going to go into what's called desensitization, which is super important, kind of getting kiddos used to people working in their mouths. And then we'll go over some things like that we could be doing in our home care routines and maybe talk a little bit about the dental visit as well.
So my journey to dental hygiene started when I was in third grade. I'm the twin on the left in the green. When I was in third grade, I went to the dentist and the hygienist. She was so beautiful and polished and pulled together, and she had the same name as me, Candy. And at one point in the appointment, she pointed to herself and she's like, "This candy is good for your teeth." And it sealed the deal. I knew then and there as a third grader that I'd be a hygienist. It would somehow make me really polished and pulled together. And then I would use that joke. So fast forward a few years and I became a hygienist. And imagine my disappointment when I realized that it didn't suddenly make me really polished and pulled together. But I, however, was able to use the joke, and it's a really big hit with my geriatric and pediatric populations. They think it's very funny. After graduation, my husband and I moved to Oregon, where we welcomed our third child, a little girl named Reagan, and she was born with hydrocephalus, which is too much fluid in the brain. Um, Thankfully for us, we found one of the best neurosurgeons out there. And Dr. Baird isn't one of those people, she's amazing in her field, but she's also just a good human. Where a lot of the neurosurgeons will just shave the little girl's hair, she'll braid Reagan's hair 8 different ways to preserve as much hair as possible. So you can imagine our complete sadness when we heard that she was accepting a job at Boston Children's Hospital. Um, my husband and I, we didn't know what to do. And we interviewed other neurosurgeons and we couldn't find one like Dr. Baird. So one night we were getting our kids ready for bed and we were talking about what to do. And I said, "Should we move to Boston?" And he's like, "Yep," without skipping a beat. And so, because we never been to Massachusetts and we didn't really know anyone, I started to research things like friendly places in Massachusetts. And we ended up buying a little farm sight unseen. So the first time I'd ever been to Massachusetts, I was on the plane with my husband and my 3 kids and my 3 bunnies, Wally, Jolly, and Molly, and my puppy. And I remember coming into the Logan International Airport and I was like, "Where are the mountains?" We didn't know anything, but what we especially didn't know is that in 2 years, we would be welcoming our daughter, Miley May. Miley is one of 7 kids. She has 6 brothers, and her mom unexpectedly passed away when her mom was just 37 years old. Her dad was not in a position to take care of Miley, and so she ended up in foster care. The first time I met Miley, we met Miley, it was the same feeling I had when I met my 3 biological children in the hospital. My heart knew her heart. She was mine. I was hers. I felt my whole body. I thought I was going to burst with love. So I will never forget that day. But something else stood out about that day, and it was something that, annoyingly enough, my little hygiene brain, right when I walked in, I could smell. It's something we all talk about in the dental hygiene world that there was a periodontal infection. And if you've smelt it, you'll always know what it smells like. When Miley came home, I think I recognized that she had a lot going on. Miley sees 19 specialists at Boston Children's. But I thought, I can handle from her nose to her chin because I'm a dental hygienist. But the truth was, I was overwhelmed big time. She she had the smell that I was talking about that made it so my nephew who has autism couldn't be in the same room as her, or the same car as her. She had blood on her pillow and she was extremely orally defensive. Children that are G-tube fed because they haven't had the opportunity to eat and drink, they oftentimes don't want things in their mouth. To complicate this, because of her complex social history, she didn't want to be touched. It took her 7 months before she would let me hug her, which is crazy because now she's not happy unless we're touching. Um, and so me trying to brush her teeth felt impossible. And in addition, she had all these extra teeth. She had 8 teeth that just didn't fall out. The first time one of the first times my middle son, who was in third grade at the time, saw her, I remember him looking at her, looking at my husband and I, looking at her back and forth, and then said, "It's too bad she can't eat because she's G-tube fed, because she would be so good at eating corn." And so anytime I see these pictures, I think, man, she'd be so good at eating corn. So today, knowing that your situation is different than mine, our goal is that I can share the journey we took Miley through in hopes that you can generalize some of the information to your particular um, situation. And then at the end, we'll have time to answer any questions. So today, our case study, this is Miley 2 years ago, 11-year-old female with a complex medical history and a complex social history. So if Miley was your child or the child you're taking care of, what would you do? Because I didn't know what to do. The first thing we did is we had her go to Boston Children's, and under anesthesia, they removed 8 teeth that should have fallen out, but they didn't. They did a cleaning and a comprehensive periodontal exam. The next thing we did is we worked on her oral tactile defensiveness. So, if a child is truly orally tactile defensive, an occupational therapist or speech pathologist is the best person to see. My husband's an OT, so we were able to do a lot of stuff at home. And for us, that looked like playing a lot of games. And so just earning Miley's trust. And then we do things like chubby cheeks back and forth. And I would put chapstick on myself, my daughter, her, anything we could do to get her familiar with her mouth. She was very orally unaware. So a lot of times we'd have to remind her to swallow and stuff just because she wasn't speaking, she wasn't eating. So she didn't have a lot of awareness of her mouth. We would do something called motor mouth. I would do a toothbrush up her arm, touch her tooth, cheer. And we just do this over and over. Deep pressure all over her face, blowing bubbles, tissue race where we'd have a tissue and we'd blow and see who could do it the fastest. And because she's my child, I would just have clean hands and I wouldn't wear gloves because that can be off-putting for children like Miley. The next thing is, but we did a lot of immersive activities. She already liked reading books, so I would include some dental books in there. Anything to give her a positive connection to dental stuff. We sing songs. She loves cartoons, so we'd watch Peppa Pig brushing his teeth. When the other kids were brushing their teeth, they would do it in front of her, and I would cheer for them. I got toys on Amazon, and we would pretend to be dentist. And I honestly think we did too good of a job because now she wants to brush her teeth all day and she used her device at school to say she's going to be a dentist. Social stories. We often hear about social stories. I recently read some research and it was on children with autism, and they said to do the social story close to the appointment. I thought you would do it weeks before, but they're actually finding the closer to the appointment, the more effective. Brushing technique, stabilization, and product recommendations. So now we're getting into brushing. Before we jump in, imagine that you are the cutest 11-year-old in the world. You hate having someone in your mouth. And then this lady comes at you every night. Poor Miley. Like, I can't even imagine. So, for brushing, there's two things we want to remember. One is continuity for all caregivers. A lot of times people want to do a cute song or a cute cartoon, but we want it to be easy enough that you can do it, your your spouse, your nurse, the OT at school, the grandparents, anyone that's jumping in to brush is doing the same thing every time. So for us, we like to use a triple-sided toothbrush. We'll brush each section for 10 seconds and then spend extra time on the front teeth. The other thing is when you're brushing a child's teeth, you want to come from behind or above. And this is because this is the way that they will have their teeth worked on at the dentist. And so we want to be doing the same thing to make them comfortable. Two stabilization don'ts is the headlock. And this is when you watch people try to brush their kids' teeth, they'll put them in a headlock. And so I've seen like small moms trying to jump up to their special needs teenage son and put them in a headlock, or the chicken pecking. And that's where you're standing in front of your kid and you're trying to get it and they're trying to dodge you, which is not effective or very safe. So we're going to watch a quick
So,
video.
so this is a stabilization technique we use to keep Miley nice and safe and nice and snug. So she lays on the ground and my husband gently puts his legs over her arms. And then using a triple-sided toothbrush, we brush each quadrant for 5 seconds. We usually count to five and then we cheer. Sometimes my other kids get involved and they cheer and she loves it. And this is done in the 12 o'clock position, so she can be used to having someone clean her teeth at the dentist in this exact position, laying down. If there's an area that needs more attention, we use a different toothbrush to act as a bite block to really get in there. Right there, I hook and spin around, and that's how I get the anterior teeth where she has low muscle tone. Sometimes it can be pretty challenging to get those anterior teeth. So the hook and spin is what we do. And you can see it a little better right here. I'm using my thumb to retract her tongue and really getting in there. Then I always end with massaging to help strengthen her muscle tone and to desensitize.
So I said there, 5 seconds. We started slow. We started with five and then we built up. And now, honestly, girlfriend can go minutes. It's amazing. But before we, I recommend stabilization techniques. Be sure that your child doesn't have atlantoaxial instability. That is where um, there's loss of stability between the atlas and axis of the C1 and C2 vertebrae. It's common with certain syndromes. Two of Miley's syndromes, Down syndrome and Loeys-Dietz syndrome, make her more vulnerable to atlantoaxial instability. The problem is if this area was compromised, it could cause huge problems, even paralysis or death. Thankfully for us, Miley, when we've done the radiographs, she's clear. But it's something that before you start stabilizing your child or anything, if they are at risk, you want to make sure that they are safe. Okay, so I am going to share something. We did all this desensitization and we did all this work to get Miley ready to go to the dentist. And I don't know what I was expecting, but I think I was expecting like a pat on the back, like a good job, mama. We can open her mouth. And even if we clean the two front teeth, this is such a success because we're here. And guess what I received? Something that probably every other caregiver. I got a lecture that I should be doing better. And I was ticked. I was like, what the heck? Like, I'm just happy that we're in her mouth. Like, do you know how many, like, I literally would just sit there and like fish hook her to get her used to being touched. So, anyway, I did not get my gold star. And then the dentist walked in and he grabbed the air water syringe and he starts to almost spray it in her mouth. And I yelled, she's high aspiration risk. You can't spray water in her mouth. And I left feeling so discouraged. And I started to think, you know what? This feels a lot different being on this side of the chair. And I bet I'm not the only caregiver that has ever felt like this. So I'm going to turn the time over to Shelley, and she's going to share some preventative things we can do to make it a better appointment for you and for things to do at home. And I apologize on behalf of any dental professional that's made you feel that way because it's terrible.
Yeah, when Kenny told me that story, I was so heartbroken. I'm hopeful that there are some providers on here, not just in dentistry, but like healthcare providers. And just to remind us all as healthcare providers that um, I always try to find like the positive, right? That's one of my goals. I've researched a lot on what's called motivational interviewing and how to really change behavior and support patients where they're at. And yeah, finding the good things that they are doing so they can continue to do those and not giving those guilt trips is so important. So, as Candy said, I'm going to take you through some great dentistry things that you can do for prevention. I feel like it's really hard to go in and sedate a child, right? Candy, you had to have her go to Boston Medical. They have to remove all of her calculus. She has to be sedated. And just that whole process is not great for, you as the caregiver. It's difficult on the child to be sedated. And so when it comes to teeth, if we can prevent, that's going to be the best. These two tables here on the screen are from the American Dental Association. These are what are called the Canberra Caries Risk Assessment forms. So we do these cavity risk assessments to know like are they low, moderate, or high so that we know how to best treat the patients. And essentially, when they have a special needs healthcare, a physical or mental limitation, that cavity risk increases. And I use these guides quite a bit because I actually work in public health. I own a mobile dental hygiene practice where I go see geriatric patients, but they have really limited physical needs. They've had strokes. And so we can apply a lot of these things to a lot of different ages. But just keep in mind that cavity risk is increased to high risk when there are some special needs. So as a caregiver, I know you're thinking, I want to do prevention. I want to do the best I can. So we're going to give you some great ideas on doing that. And Candy, when she told me how many specialists she goes to see, which some of them are on here tonight, I was just amazed at how much time she invested in her little one and just, how much you guys care. So I know this might be one more thing, but it's also just great to have the knowledge and to be able to make the referral and know who to see and what you're seeing in there. So let's first go through some of the products that might make your life a little bit easier when you're working in the mouth. Now, these are little dental props, mouth props. Candy uses the one on the lower left. It's kind of bluer. It's on the end of her toothbrush. She uses a bunch of different kinds of toothbrushes, I feel like. But this is one. So sometimes it's hard when they bite down. You don't want to get bit. I don't know if any of you have ever been bit before, but that is no fun. They don't open well or quickly, and it's very painful. And so we could use these little mouth props, and you can also recommend these to parents to help care for their kiddos' teeth at night. I personally love the ones that look like little scissors. I have those. I had a child, he did not want to have me brush his teeth ever. And so I always had to kind of grab the mouth prop and then the little scissor part where your fingers go in. I could kind of control his mouth. I could hold on to that while he was shaking his head and stabilize him just a little bit. And then it kind of jacks up slowly versus like a sudden, jabbing in the mouth. So I really like those. And I got those on Amazon. All of these ones are on Amazon, easily available. And you can just clean them off like your normal toothbrush. And then what about toothbrushes? What are we recommending? So there's a manual toothbrush. Those are great. Awesome. They remove biofilm because they have a little nylon bristle on them. But if it's difficult and you have a really hard time getting in there with the manual one, an electric toothbrush, like a nicer one, not just like a $10 one, but one that's in the $50 range, they have been shown to do to remove the biofilm or plaque on the teeth 10 to 20% better. So electric is going to be a little bit better. Candy showed in her image or in her video, that she had a triple-headed toothbrush. That's the one on the lower right, where it has a top and two sides of the toothbrush. And the tricky part about that toothbrush is they did some studies on it and just sometimes it doesn't get pushed down far enough. So we're brushing the tops of the teeth, but probably the most important spot to brush is right where the tooth and the gum meet. And so if they're not getting that toothbrush down along what we call that margin of the tooth where the gum and the tooth meet, then they're potentially going to be at higher risk for what we call gum disease and where the gums start to bleed and become inflamed. And so that just means they're not getting that area removed of that plaque. So really important. So you got to make sure you always push that toothbrush down. They also came out with these new really cool full mouth toothbrushes. The one on the left, far left upper, it just became approved by the American Dental Association, which is really exciting. This one is through the Auto Brush, and I like this one because it has a nylon bristle. And you put the whole thing in the mouth and you can shift it right to left to clean the teeth. Some of them, though, are made with this rubber bristle that I have a big X on, and the rubber bristles do not remove biofilm. They do not work. So if a patient's interested in a full mouth brush, then something with a nylon bristle is best. And there's a few different kinds. The Samba toothbrush in the middle, it's actually a little robot, and these arms jiggle that back and forth for you. So you place it in the mouth, seat it all the way, push the button, and it really does all the work. And it really shakes your head left and right. It's a little more expensive, but if it gets the job done better for you as a caregiver and it cleans all the teeth for 30 full seconds versus each tooth individually for 5 seconds only, then maybe it's a really great option for patients. Okay. So there's a lot of great options. Toothbrushing is one of the most important things that, if we didn't choose any toothpaste or mouth rinses or anything like that, at least toothbrushing is probably the most important oral health thing that needs to be done. And at least twice a day for sure. Now, Candy's little one, she's high risk aspiration pneumonia. And so she's concerned about any bacteria anywhere, right? Where most people may not care so much about disinfecting their toothbrush, she's concerned about spreading bacteria that doesn't need to be spread. So your toothbrush can be disinfected. They did a few studies on this and they found just like 50% vinegar with water works the best. Like a dishwasher and a microwave do work, but usually when you put your toothbrush in there, it melts. So they don't really make toothbrushes that are like microwave safe at this point. So 50% vinegar and a little bit of water works really great for disinfection. A UV light that's ADA approved is also another good option. And then they looked at even the bristle of the toothbrush. And if you use one that has like a charcoal bristle, it will usually look black. They found that that does reduce some of the bacteria on there because of that charcoal aspect. So disinfecting the toothbrush may be important to you if they're high risk for aspiration pneumonia. What toothpaste should we use? Now, Candy and I were chatting the other day, and she was like, I like this toothpaste, but they don't have this flavor. And it's just like there's so many options that it can be a little bit confusing. And she was like, this one patient doesn't even like this tooth, like they have a hard time with toothpaste. Honestly, like if you're just like, I cannot get them to use or like a toothpaste, that is okay. I'll tell you that the toothbrush, mechanically removing the biofilm, is going to be the most important. And our toothpaste, they can help do that. They have like abrasives in there that remove the biofilm, but your toothbrush will do that just as well. So toothpaste, I kind of look at them as a medicament. It's like a medicine. It's like a booster. But if they're just like not tolerating it, it's okay not to use a toothpaste, but toothbrushing then will become even more important to remove that biofilm, the sticky stuff on the teeth. Um, there is this one right here on the screen. It's called Live Fresh. This is my most favorite toothpaste. You can get it on Amazon. I use it on all my mobile patients to brush their teeth before I begin because most of my patients are not getting their teeth brushed at all. And so several of them, it's very painful when I go to brush their teeth. So this toothpaste makes the biofilm, the plaque on the teeth more slippery. It works with the calcium forces that are adhering the plaque to the teeth and makes them remove a lot easier. So it actually removes plaque 250 times better, which is the main cause for gingival diseases, gum diseases, and for cavities. And so it just makes that biofilm slippery on there. So if you do a better job at removing biofilm, then you're going to reduce cavities and gum diseases. So I really like that one. And then I'll use that one in conjunction with like a fluoride toothpaste, or some might not want to use fluoride, which is, I'm a big proponent of fluoride. But if you are not interested in using fluoride on the little ones, a hydroxyapatite toothpaste is also showing really good promise. And I've been using one that mixes those two together. I mean, why not use both? Because the fluoride takes what's called hydroxyapatite and adds it back to our tooth. So there's some toothpastes out there now that have both in them, which is really exciting. So those are some toothpaste options. I will say, like Miley, she gets a lot of calculus buildup, and something that has a phosphate or a zinc in the ingredient. There's a lot of different types of phosphates or zincs, and a lot of different versions. But if there's a heavy calculus buildup, a toothpaste with a phosphate or a zinc in it can help with that calculus buildup. And once again, if you have any questions, pop them in the chat. Even for yourself, we'd love to answer anything that you have questions on. What about cleaning in between? So the toothbrush isn't going to reach in between the teeth. So they do say that if the gums are really tight and everything is pretty healthy, preventively, we could still use like a floss. They have electric flossers, they have floss holders, they have, the fingers might be a little bit impossible, but any type of floss will be great to get in between there if there's true health. But if you see these little brushes at the top, they actually just not recently, but in my textbooks where I teach at a dental hygiene school, the textbook now says that these little brushes, if they fit between the teeth, are better than flossing. So I actually just recently moved myself to these little interproximal brushes for a better clean in between my teeth. There's a few areas though that it does not fit, so I still have to floss those particular spots. So there's also a water flosser, which if there's already like a disease process going on in the mouth and pocketing, the little brushes and floss can't reach like deep down in a pocket. Sometimes there's like bone loss around a tooth, and these water flossers can spray water down in those pockets and disrupt that bacteria a little bit easier than the floss or brushes can. But someone like Miley who has high aspiration risk is not going to be able to use a water flosser. So, in that case, we're just going to maintain with these little brushes. And Candy, I think you might have to give us a little nod. You're just using like a slate flosser, like an electric style flosser. Is that right? You just got one of those, if I remember right.
For Miley, I actually use interproximal brushes.
Oh, yay. Oh, good. I know you had said you got one of these, but maybe we had talked and you're like, I'm getting the
Yeah.
brushes.
The rest of the family, because there's more health, but for Miley,
Yes,
we
the
do that.
brushes. I love it. Perfect. Okay, then from there, should we be using a mouth rinse? Now, to get the right dose of mouth rinse, they have to rinse for the recommended amount of time, which is like 30 seconds. Now, most of those with special needs, it's really hard to rinse. And we don't always want them to swallow. So if they're not able to rinse, it's okay not to use a mouth rinse. You could use a swab, these little swabs here that are on the screen. You could put some of the mouth rinse on there and swab potentially. But there's really no great like studies that works long term because usually most the efficacy shows like it has to be done for the 30 seconds. So if they're in a hospital setting, maybe, and there's nothing else, like we don't have their toothbrush and but maybe there is some rinse, we could definitely go in and sponge some of this medication from a mouth rinse into the area. And something like a Closest is the brand name, but all of a sudden I'm not remembering the actual ingredient. It's called a chlorine something chlorine dioxide. I might have to look this up. So sorry about that. But it's a chlorine dioxide and sodium chlorite is what they mix it together. That doesn't deactivate the toothpastes. The brand name on that is Closest. And more people in dentistry are really liking that mouth rinse. But that might be a great option. There was a study done on those who were intubated, and they did a swab with what's called a chlorhexidine. It's a prescription mouth rinse. They did that, and it did help reduce the bacterial load. So if there's an emergency situation like that where they're intubated and we can't really brush the greatest, that might be an option. But my sister, who's a nurse, she said that they do go in and brush when they are intubated. Maybe some of you know a little bit more about that. So that is good to hear that they're doing that because they should definitely, if they're intubated, still need oral health care throughout. Bacteria still working in the mouth. There's also these awesome adaptive products that make the brushes a little bit wider. If they like to use a specific brush, but maybe it's hard to grip or hold, you could buy any one of these options and just make that handle a little bit bigger. I use these a lot for my patients who have had a stroke and it's really hard to grip. Just makes it a little bit wider. And these ones are clean, more wipeable and clean easily. It used to be when I was in hygiene school, they're like, get a tennis ball and put it on the end of the toothbrush, but the tennis balls got really gross. So now we have these really, much better options for patients to be able to adapt their toothbrushes, make them easier to hold. Okay, so at the dental office, maybe what are some of the adjuncts that we are using? What might we want to talk to our dental professionals about? So those are the things we were using at home, but what are some other options that maybe we can use? So one is called povidone iodine. We're going to talk about xylitol probiotics. The povidone iodine, this video does not have any sound, so you're just going to be watching it here, but it's a betadine, just the over-the-counter betadine. And there is an FDA approved product that you could get from the dental office if you'd like, but I just buy these little sticks off of Amazon. And if they're high risk, which our special needs patients are, you just paint the iodine on the teeth once a month. Only once a month. And this is not weekly, this is not daily. Once a month, and it kills what are called the strep mutans. And strep mutans are the ones that are really particular in causing cavities. You can see her afterwards. I'm wiping a fluoridated toothpaste on because those work synergistically together to prevent cavities at an 80% rate, which is really high. So the reason why we get cavities is because of the bacteria, right? So if we can better control the bacteria, maybe not always just throw fluoride on it for remineralization, but if we can kill the bacteria, then that will help. So that's what the povidone iodine helps to do. And that bacteria is actually um, transmitted from mother or father to the child, siblings past that. So, everybody in the household could be doing something like this. When I go into my patients, their caregiver, I'll say, hey, tell me about your mouth too, because if they're high cavity risk, like we should control your cavities too. And we all just do a little, one of those povidone iodine 10% wipes on the teeth. And it helps to shift the microbiome. And it does have some contraindications though. And so sometimes our medically compromised kiddos might not be able to use this. So you can see if there's an allergy to povidone iodine or they're reactive to it, to the medical imaging version, if they have beta thalassemia major, if they have a big wound inside their mouth, or if they have advanced thyroid disease, which maybe Miley might have some type of, I don't remember talking about that, Candy, but that would not be a great option for these little ones to get too much iodine. So yeah, if you're going to use it from a little dropper from the grocery store, you only want to use 8 drops. You don't use very much at all. And then you kind of dry the teeth or have them spit. You place it on how I'm showing in the video, and then you can wipe on a fluoride toothpaste and you have them spit, but they don't rinse for 10 minutes afterwards. It does have a little bit of an earthy taste, as you can imagine. And I know you're looking at that screen thinking, is this going to turn their teeth yellow? And I promise you, it does not. That color dissipates. You can see here my gloves are a little bit yellow, but you can see that the teeth are not going to be stained yellow. Patients always get a little bit concerned about that, but I promise you, it does not stain the teeth yellow. But really great for destroying that bacteria. We're really also focusing more and more in dentistry on the commensal or the good bacteria. And so there are a few different brands out there that are great for dentistry. Anytime after they eat, anybody eats, they could have a probiotic on mint, and that will help support the commensal because if we support the good bacteria, then that will control the bad, our strep mutans that cause cavities, as well as what are called our Porphyromonas gingivalis bacteria that control or that can cause gingival diseases. So our probiotics are really excellent. Have one of those after a meal if you don't have your toothbrush around. Great option as well as maybe xylitol. If you don't have a probiotic, you could try xylitol. They say to strive for 5 to 10 grams 3 to 5 times a day. So usually after every meal, I'm like, here's a little tiny mint or a little candy, kiddo. You could have something like this. Obviously, Miley, she can't eat, right? And so Candy actually does take back on the probiotic one. She will take the probiotics on a little mouth swab and kind of wipe it around her mouth. So you could do that. They make these in sucker form. Like my kids get a sucker before bed. I know that sounds really crazy, but it has xylitol in it, and that can help control their cavities while they're sleeping at night. And just after meals is a great time to give a little xylitol. There's a lot of different types. There's gums, there's little mints, there's little chips. So if they can have something like this might be an option. As for just wiping it in the mouth, um, I don't know if we could get enough grams wiped in there safely. But if you have questions about that, we could probably figure something out together. And then in dentistry, we're really focusing, there's this new push, it's really interesting, called no drill dentistry. I mean, who loves to go get, a shot and a filling done, right? Not me. So we're trying to, in dentistry, find cavities a little bit earlier, and we're placing what are called silver fluorides on the teeth, and we're finding those areas that we need to place a silver fluoride on with what's called blue check. So let me show you this image here. This is a natural protein linked dye material that just came out in dentistry this year, and it has a high affinity to hydroxyapatite, which is what the teeth are made out of. And we put this little liquid on, we rinse it off. Obviously, Miley couldn't have something like this. But she could have the options. We could find some areas that we just need to fortify through other ways. But we place this on in any areas that turn blue. We would want to fortify those with a silver fluoride and catch those cavities when they are so, so tiny. So kind of new and exciting. And then our silver fluorides actually, physicians or the healthcare world, the medical world, I should say, now has a code to place a silver fluoride in the practice. And so, let's see, let me see if I have a better picture of the silver fluoride. Let me go back to actually, sorry for that. So what it is, it's a liquid silver diamine fluoride. And if you put it on what's called a sound tooth structure, like there's not a cavity on it, it will actually prevent cavities from beginning from even starting. So for example, I place this on all my mobile patients interproximally on all their teeth well, on them I'm doing it every 6 months, but on like normal private practice, I would probably do it yearly at least. And that will continually kill off those strep mutans. The silver in there binds to the tooth and continually kind of repels those strep mutans from building up in between the teeth. If they can't get in the area, they can't release acid that then demineralizes the teeth. And so, if we can do these tiny little drops, one drop is about $1, and one drop treats 5 teeth. So it is super cost effective in dentistry, and I really would love more and more medical providers to be able to start placing it, especially like pediatric providers. If you go for your vaccination checks and they do vaccines, and we look at your mouth, and we also place silver diamine fluoride on the occlusal pits of all the teeth and a little dab right interproximally between the teeth, that will prevent cavities, and then we have less children being sedated and less dentistry that needs to be done, no drilling. Like it's really exciting new product. Well, silver diamine fluorides have been out for 10 years, but the World Health Organization says that they are an essential medicine. And so I'm really excited to use this more and more in dentistry. If there is a cavity that does start too, we can place it on that area. It will turn it a little bit dark. It'll turn it black actually, if it's already started to become a cavity, but it will stop that cavity in its tracks so it doesn't get into the nerve and then cause abscesses, which could potentially go systemically and would need more work that could be done. So if we even have a small cavity, we can catch those earlier and prevent them with this silver diamine fluoride. So hopefully we never have to drill on these little ones' teeth if we can catch them a little bit earlier. So I would recommend like, as soon as you see these little ones, start asking your doctor, like I would love the preventive silver diamine fluoride painted on my little one's teeth. Candy is concerned always about liquids though, so that if that is the case, I don't know if this could be used because it is a very small drop of liquid that goes on a little spongy brush, but it's not like we're pouring something in their mouth or rinsing with it. It's very, very small dose. So, obviously, you'll always want to ask your dental provider about what is best for you and the ones you're taking care of. So from there, also, let's say, for example, this is a kind of a rare study, but maybe you have a little one who does, have gum disease and they don't want to sedate them, but they do have, this inflammation. And then when you have inflammation in the mouth, it's going systemically, and these virulent bacteria are entering into the body and the bloodstream, and they're landing in other areas, wreaking havoc. for Alzheimer's patients, diabetes, any other inflammatory conditions are exacerbating. They did this interesting study where they actually placed that silver-diamine fluoride not on the tooth, but in the gums. And this is a kind of a before and after. They didn't do any cleaning, but we can see that there is a reduction in inflammation. It doesn't look 100%, but the biofilm doesn't build up as easily. There's a reduction in inflammation because the biofilm has essentially been killed off and deactivated. And so if there's kind of an extreme case where they need dental care, but it's like maybe contraindicated to clean their teeth quite yet or be sedated, this little liquid might also be a great option for them in the meantime until we can get some better care for them. And then, yeah, what's the safety on this? It's been around for 10 years here in America and in other countries for a very long time, but it has what's called a high LD50, which is a low value of toxicity. So it does have fluoride in it, it has silver in it, has ammonia in it, but it really absorbs mostly just into the tooth and not systemically to help us prevent cavities. So this is a tooth here that had a cavity on it and was arrested with the silver-diamine fluoride. The dentist can then choose to do a filling, or they might just be like, let's place the silver-diamine fluoride on it every year and not drill it. If it's a back tooth, most patients don't care that it's a little bit dark, but usually on the front teeth, we'll put a little filling over the top of that. So with that, I'm gonna have Candy come back on. She's gonna go over a few more things, and then we'll have some time for some questions if you have any.
Okay, so I wanted to just kind of breeze by some of the conditions Miley has and the oral implications. And obviously, Miley's conditions are going to be different than your child's. But just to get your mind recognizing that there is a really strong oral systemic link. So I think the next slide is Miley has Loeys-Dietz syndrome, which is a connective tissue disorder. One of the things they look for is a bifurcated uvula. So that little ball at the back, if it's shaped like an upside down heart, that could be a sign that someone has Loeys-Dietz. Also, children with Down syndrome have a 20-fold chance of developing leukemia. One of the signs for leukemia can be an oral or orally manifestation. Um, Sometimes with different conditions, you can see that the child has a condition right when you see them. A lot of times, people will talk about kids with Down syndrome having really large tongues, but the truth is, when they study the tongues, it's not true macroglossia or a big tongue. It's actually just that they have a really small upper and lower jaw. So on the next slide, you can see that there was a really interesting study up to 6 months. The upper jaw, the roof of your mouth, is develops typically for children with Down syndrome, and then because of the low muscle tone, tongue posture, they develop a narrow upper palate, which makes it really hard for speech and eating and different things. And so they found that if they can intervene quickly, like at 6 months, and they do palatal plate therapy, which is like a little vibrating plate, then these children do not have are less likely to have the speech and eating problems that we often see with Down syndrome. So it's just important to know that there's some interventions that we can do early. It's been mentioned a lot that Miley's high aspiration risk. So this is the dentist and hygienist job. But because I know that we all have to advocate more than we should for our kids, there's a couple things I'm going to point out so you guys are aware. If your child is high aspiration risk, they cannot be using water on your child. So that little device that they use, that's a cleaning tool that sprays water, should not be used. They should not be using air water syringe. At the end of the appointment, sometimes hygienists forget and they want to polish their teeth. Do not let them. They can't lay your child flat. We want to do everything possibly that we can to protect the airway. And so I would never let just a dentist or a hygienist clean Miley's teeth. It's always two people. Either the dentist and assistant or hygienist and assistant. And oftentimes it's three-handed hygiene because I'm in there too. But we're just have to be very, very protective of that airway. And if they're not, make them. So Miley's G tube is what has given us a run for our money. I asked my husband, I said, what did we talk about before we only talked about her G tube and if she pooped or not? Because when Miley came in the picture on the left where it's infected, that's what it looks like, and now it looks like this, which is a huge win. But children with G tubes have a different bacteria than typically kids that eat typically. They are low risk for dental caries and a high risk for dental related aspiration pneumonia. So when we had Miley's teeth cleaned at Boston Children's, after she was done, I opened her mouth and I was shocked because the biting surfaces, which we call the occlusal surfaces, were caked with tartar. And I went to the dentist and I said, how come there's all this tartar on there? And the dentist replied, oh, we do it to prevent cavities. It acts as a natural sealant, on and on. So I went home and I started to research. And what we found is that the studies showed the type and amount of bacteria in tube-fed patients is different than non-tube-fed patients, even if the oral hygiene is similar. So even if the caregiver is doing a great job, these kids have different bacteria, and the type of bacteria they have puts them at high risk for aspiration pneumonia. Tube-fed individuals are low cavities risk, but high aspiration risk. So it started to really not make sense why they were leaving all this tartar on their teeth. When they looked at only tube-fed children, the more tartar the child had, the higher chance of aspiration pneumonia. So I was thinking, if it's the amount of tartar, then why are they leaving on the biting surfaces? Long story short, I was able to contact Harvard. They were not very receptive. They said stuff like, we're Harvard, this is the way we've always done it. And I reminded them that for Miley, we don't have the privilege of just doing things because it's the way it's always been done. And they finally agreed to look at the research. And Miley was the catalyst for a policy change at Boston Children's and Harvard Dental School. Yay! Thank you, Jill. Okay, something else is reactive airway disease. If your child's doing an inhaler, they are at increased chance for fungal infections. So the mouth should be wiped out after every time you do the inhaler, and we're doing like a probiotic. Every time Miley's in the hospital, she gets thrush. Epilepsy, some of the drugs that kids with seizures are on can make their gums really, really large. And that has nothing to do with what you're doing at home. I mean, we always recommend keeping things clean, but sometimes the body's working against you. Kids with epilepsy have a high chance of losing teeth. If your child loses a tooth, you grab it and you put it back in as fast as you can and have them gently bite down. If you're afraid to do that and you're like at a park or something, put it in your cheek until you get to the dentist, put it in milk till you get to the dentist, but you want to keep it moist and do everything you can because a lot of times if a tooth gets knocked out, they can put it back in. And the Miley unfortunately just fell at school, and so we're dealing with this now, but we were able to get it in a position like fast and hard, get her in the position that right now her teeth look okay, and we're just praying it stays that way. But so as a caregiver, even though it's scary, try to get that tooth back in if you can.
And just don't put it in water. That's the big thing.
Do
And
not put it
like
in
you
water.
said, milk. Milk is great. Milk is probably the best, or even nothing, possibly. But get them to the dentist ASAP.
Miley has a pacemaker, and I feel like the recommendations are all over the map. So if your child has heart conditions, the best thing is to ask their cardiologist what they want. Something to be mindful of, children with pacemakers or individuals cannot have electronics 6 inches. It has to be with more than 6 inches from their pacemaker. So my hygienist or dentist, I would not let, not, I'm not saying let, I'm not like, but I would encourage that they did not wear a smartwatch because with special needs, there is a lot of resting on the child's body. And I would not want to take, even though it's a small risk, the chance of them resting on her pacemaker. Ending with this. And this is just because this is Miley's best friend, Emma. And this is just a reminder that, we sometimes get caught up in the medical side of children that have a lot of complexities, but every human has a right to have access to good oral health. And I am just super encouraged that with some of the information that Shelley shared and stuff and if you guys have questions that you guys can do a lot at home to make it a positive experience for your children. And if you want a very flattering picture, if you would like to connect, here is our information. She's won tons of awards. She's the top of the top in the dental world. And so if you have questions, call Shelley or ask Shelley. If you want to hang out, there's my information.